Hello, this is Dr. Lindy Vaughn with Integrated Health Systems, and today I'm going to be talking about what you probably don't know about gluten sensitivity. Celiac disease is often considered to be synonymous with gluten sensitivity. In fact, many doctors and healthcare providers believe this to be true as well. If an intestinal biopsy does not find evidence of damage to the small intestine, then the patient does not have celiac disease, which is often translated into the belief that the individual does not have gluten sensitivity. Furthermore, if the individual is not experiencing any gastrointestinal symptoms, they will likely never be considered a candidate for celiac disease and will never receive blood testing for gluten sensitivity. In some individuals, gluten sensitivity can manifest solely as a neurological disease, and in others it can result in the development of an autoimmune disease. Neurological symptoms include fatigue and depression and can mimic the symptoms of many more serious neurological and autoimmune conditions. Only a third of those individuals with the neurological manifestations of gluten sensitivity will have any intestinal pathology. This leaves a large portion of the gluten-sensitive population either undiagnosed or misdiagnosed. Research is showing that there could be a link between patients with gluten sensitivity and a diagnosis of depression, hypothyroidism, Parkinson's disease, or various other autoimmune diseases. When these patients present with symptoms of these diseases and there are not intestinal symptoms, many doctors rule out or overlook celiac disease or gluten sensitivity as a potential diagnosis. These patients will be treated with drugs for these specific conditions, and they will not be advised to eat a gluten-free diet, so their condition will likely progress. This is not to say that these diseases do not exist in lieu of gluten sensitivity, but it is worthwhile to look into gluten sensitivity as a causal factor if symptoms of any of these diseases are being experienced. Another problem with the popular diagnostic methods for gluten sensitivity is the fact that most of the laboratory testing only involves two of the markers for gluten sensitivity. This limited testing can lead to a lot of false negatives, which leaves gluten-sensitive individuals thinking that it's okay for them to eat gluten when they actually shouldn't. More advanced testing checks for 12 possible markers. This not only allows for a greater likelihood of catching patients with celiac disease before intestinal symptoms progress, but also identifies individuals who are likely to experience only the neurological or immunological symptoms of gluten sensitivity. With more comprehensive testing available, it has been estimated that the prevalence of some type of gluten sensitivity may be a high percentage of the population. Celiac disease is a serious condition. It is known to increase the risk of cancer and result in early death for those who do not adhere to a gluten-free diet. There is less known of the ultimate consequences of other gluten sensitivity-related conditions, but no reason to believe they are any less dire. If you care about your health, don't be one of those individuals out there who doesn't know.